Ah! Oh my. Sorry, guys. Good evening, guys. So I hope you guys have a wonderful weekend, that you are ready to start this new module. So we are moving on with the medical assistant office administration office procedures. So let's see how we're going to learn all this information, because very important subject, because this subject is going to discuss how to communicate with our patients. Remember, this is a mass effective communication with our patients, with the staff members, with everybody who works with the facility in which we are working. So it's very important that we have a good communication. If there is a lack of communication, that's going to cause some issues that later on can bring problems to the office, to the employees. So it's very important that we understand that we're going to learn in this module how to deal with the patients, how to collect the patient's information, how to verify patients' medical coverage, insurance, how to document all this information in the medical records, whether it's paper-based or it's electronic medical records, how to schedule patients, the types of scheduling formats that the office might have. Usually they have different type of scheduling formats. Mostly that is what we are going to discuss within this chapter. So not within this chapter, within this module. Very important information. You need to learn how to communicate with your patients. If you're not communicating with your patients effectively, then there is no communication at all. So that is crucial for us in any type of industry, particularly in the medical, when people comes with medical issues and want these medical issues to be solved. So we're going to learn that. We're going to learn your type of certifications, what type of certificates you are going to earn within this program. What are the different organizations that offer certificates for your profession as a medical assistant? So that's very important. The offices, the medical settings where you probably going to be working, different specialties. What do they do there? What type of office is this? Are you willing to work in one of these departments, in these specialties? Which one do you feel more comfortable working with? But you got to get familiar with these practices. We hear a lot of practices, a lot of medical offices, specialties, but sometimes we don't know what exactly entails to work in one of these places. So we need to get familiar with them to see if that's something that we are going to be inclined to apply for, or something that we just gonna let it pass. Remember, even though if we have a job, I'm sorry, even though if we need a job, but if we are going to work in an environment that we are not feeling comfortable with doing certain things, it's probably your culture, your beliefs, your religion doesn't go with, you don't have to do it. So We're going to see all these departments and facilities that you are going to be probably applying for jobs to see if that's something that you really wanted to do. So let's start by talking about a little bit of where is all these medical assistant came from? When did it started? How it initiates? Because we didn't have medical assistants off back in the days. Is this new? Well, how they were called before? So that's basically what we need to understand. What are your responsibilities as a medical assistant? Who's liable for if something happens in the medical field? Who will pay for it? Who will get in trouble if you don't do the things the way that you're supposed to do, if you don't follow the scope of your duty? So there are lots of questions in exams for these particular topics. It's not just about medical anatomy and physiology, EKG, phlebotomy, no. How to interact with the patients, how you interact with your coworkers, with the companies that work as an associates to your practice, the things that you do or don't do, that's very important, and they want to test you on that. So we're going to get like a little better understanding of what is it that you as a medical assistant should be doing, what your responsibilities are, so to speak. So that's what we want. So let's start with the health industry. Remember, we're going to talk about these organizations that we hear so many times about it, but we're not familiar with them. What is it that they do? Do I want to be working on one of these places? So that's basically what it is. So we're going to start with a little history of how this medical assistant profession began. So that's basically what it is. So it says right here, medical assistant program administrator, medical assistant. Oh, well, this is not the one. Medicine and medical technologies grow amazingly rapid in a rapid rates. Medical is one of those fields that regardless of what happened, we are going to have a job. Become sick mentally, psychologically, physically. So socially, it's not just that the patient becomes sick of something inside their body. Oh, that's physical. No, we have different conditions that we develop. So we need to know how we're going to handle this. Which facility is going to be taking care of this patient depending on what condition they have? How I'm going to be dealing with my patients who has all these conditions. So that's very important. Communication. Communication. There's nothing more important than effective communication. It's not just talking, it's listening. So other than that, things do not work. Now, this medical field, particularly the medical assistant, is growing every single time. There are more opportunities. There are more job openings. But you have to keep yourself up to date. You can't just say, oh, well, I graduated as a medical assistant and I'm not going to update myself. Technology moves. Everything is changing. So we have to move with. If you were not moving with it, we're not doing anything. Remember, you guys that are learning now new techniques, new approaches, you're probably gonna displace those people who were working before, but they get stuck back in the past, the way they were doing things. They're not changing. You're gonna see all these issues through this course. I'm going to tell you, and you're going to be seeing them when you start doing your internship, when you start working, you're going to be seeing that most of the things that you guys are learning right now, some of the people that have been working in the past, they're still doing the things that were done back in the days. A lot of things have changed, and you have to move with that change, with that technology. Different medical conditions, different imaging machines, if you will, new medications, new facilities, new departments, new way of communicating with the patients. If you recall, back in the days, most of the things were two choices. Or you stop by the office and make an appointment yourself, see a doctor over there, or you just make a phone call. Now there are many other ways to do it. Now we have internet. Now we have the patient's portal. Now you can use cellular phones, tablets, computers. Now you don't need to go to your office to make an appointment. You can make it from your home or from your workplace, wherever you are. But if you don't know how to utilize all this technology at work, then it's like you didn't learn anything. But some people didn't learn this back in the days, but they don't want to learn it. Sometimes technology is a little complicated for certain people. So we need to keep ourselves up to date, reviewing stuff all the time. So in this chapter, we are going to discuss national organizations associated with the healthcare industry. Which organizations actually govern the medical healthcare industry? Remember, like anyone else, like us, we have a boss who tell us what to do. Well, the health organization, it is always have some organizations that tells the medical facilities what to do and how to do it. They are controlling continuously these organizations. It's not that the medical field to just do whatever they feel like it. Oh, this is a hospital, but only the owners of the hospital, let's put it that way, controls what's going on within the hospital. No, they have external organizations, World Health Organizations, national organizations that controls what's going on with the health industry, that they want to make sure that they are up to date with all the advances in technology. They want to make sure that everyone who works in an organization, it is credentialed to work in the field that they apply for. In other words, that the person that looks for a job, you have a certificate, a license, that you are qualified to do that particular job. There are organizations that are checking that out. That when the patient complains, this not just is for internal office reviews. No, it's being seen by external organizations. When the patient has malpractice, there is a lawsuit to the office, regardless of who caused it. There is investigation from external organizations to see how these organizations are managing these problems. Are they actually committing all these mistakes, or there is something else? And they're going to give penalties to it. if you don't do the right thing. They can even close your business. So it's not that simple. Oh, well, hospital, well, the big bosses are there and they just don't care about anything. No. They actually checking if the own organization doesn't do anything to fix the problems. There are external organizations that are going to act up on these organizations. As I mentioned before, we're going to talk about various types of healthcare facilities, the places that you might be applying for a job. But you need to know, wow, did this facility actually exist? I did not know. And what is it that they do? What do they specialize? What is their practice? What is it that they do? That's what it says, types of medical practices. So that is what we need to know. And the different people that works there, what are the positions? So different professions within the healthcare. Remember, we have nurses, we have doctors, we have psychiatrists, all those things. We have medical technicians, but which medical technicians do we have? How do we call them? What is it that they do? Medical technicians is just a broad statement about who is under that umbrella of healthcare professionals or healthcare facilities. So we need to be familiar with this and the type of services that they provide. That's important. You're going to be a medical assistant and you probably are going to be working with the doctor or doctors that they're going to ask you to do a referral. And if you don't know this patient's referral, where it's supposed to go, because you're not familiar with this type of specialties or this type of professional that treat these particular conditions, then you're going to feel a little out of space. So not good. We need to get a little familiar of what is it that we're doing and where are we going to be working and where the patients are going to go to look for these types of care. So that's basically how everything begins. So we mentioned in medical terminology, for those who took medical terminology, if you didn't, not a problem. When the time comes, we're going to talk about that. But I'm going to give you an advance that every medical terminology that we use generally is derived from two languages, Greek and Latin. So these are the two major languages where all these medical terms, let's put it this way, came from. That's why medicine is a little difficult sometimes because of the medical terminology that is used to identify medical conditions, procedures, medical specialties, diagnosis. So we need to keep in mind all the time that these things can be learned. And as we practice them in our jobs, this is going to get easier and easier every single time. Do you not need to know all the medical terminology? Impossible. Nobody does. Every single day, I'm learning something new because I'm practicing. I'm doing all this every single time. And because I'm not using most of these medical terms otherwise, well, being in class is the only way that I can put them to practice. But still, there are many, many, many other medical terms that you probably going to encounter in your practice because it's a different practice, different specialty. They use different terminology. But everything is based on whatever we covered already for the medical terminology. Having a base of the knowledge of these particular terms is going to facilitate the learning of new terms. But this is with practice, little by little. So just think about this. Greek and Latin are these languages that are where those medical terms are derived from. Remember, these are questions for national exam, and that's what we're repeating then over and over and over. Remember, practice. We need to practice. We need to understand what's going on. The more we do it, the more that we remember them. That's why in every single chapter, we're going to repeat some of the things. It's like overlapping information. So don't get discouraged sometimes thinking, wow, I covered this already. Well, some of the things, yes, you did, but some of the times are adding new material. But because we don't want you to forget the things that we already covered, we're going to go over and kind of overlap some of the information. So we can bring back memories of whatever we have covered and learn new ones. That's how we learn. Because if I learned something 3 months ago and I don't go and review it and I'm not exposed to it, I'm not practicing, I'm going to forget about it. But if I'm repeating it back again, if you forgot that, if you've never seen it, well, you're going to learn it for the first time. If you have seen it before and you've kind of forgotten, you're going to bring it back. And it's going to stick more in your brain. And every single time that you encounter this, you're going to recognize these terms a lot easier than if you kind of not remembering it, not using it often. So that's basically what it is. So this is another question that comes in exams. Who is the father of medicine? Hippocrates. Hippocrates. Remember, these are very simple things, but if we are not familiar with them, if I'm not mentioning them, this is a point that can save you passing the exam. So I try to cover most of the material, not only for the class, but also for you to pass that national certification. Remember, that's one of the major points. Whether you're going to use this information later on, who knows? But the most important thing is that you pass that exam. And then you got your certificate. Now you can apply for a job. So Hippocrates is the father of medicine. And where was this person from? Who was Hippocrates? There was a Greek physician. Remember, that's why all these medical terms are derived from Greek and Latin, because most of the ancient culture, philosophers, scientists, physicians came from that part of the world using that language. So they were the one who kind of started medicine. So they used the language that they were using at the time. Unfortunately, all that was passed on to the years, and we have to use it, even though if we don't speak Greek or Latin. So that's basically what it is. So this person is important because he wrote the Hippocratic Oath. Hippocrates, Hippocratic Oath. So what is the Hippocratic Oath? This is a series of guidelines of how medical professionals should behave, act with the people that they are treating. Not in mythology, not talking about what our ancestors believe due to religion or something else. No, it has to be scientifically proven with science. It has to be something that proves that these treatments actually work, not something that somebody says that it might work. So that's basically what it is. So we're going to talk about some little things about this oath because that's important to know. What exactly the Hippocratic Oath entails? What it tells us? What is there? What is written? What guidelines medical professionals should follow? And why? Things have changed dramatically with technology, but still some of these guidelines from these physicians still prevails. We still use it. And you will see that is true. So if you have a question in your exam, when they ask you, who's the father of medicine, you're going to look for Hippocrates. Who wrote the Hippocratic Oath? Well, they're giving you the answer, Hippocrates. I cannot stress enough. I always remind you, remember, practice, practice, practice makes perfect. I always tell you things, and I always been telling you that when you read the question, be careful because the question give you the answer 60% of the time in your exams. There is a keyword right there within the question that is giving you the answer. And sometimes it's straightforward, like the Hippocratic Oath, who wrote it? Well, Hippocrates. Very simple. But sometimes we think that if it is so simple, probably it's not true. So we decide to choose something else. So don't get fooled by that. Make sure that you actually understand this. When you have something, don't doubt it. So these are parts from the writing of the Hippocratic Oath. Look at this. This has to do with ethical or ethics in the workplace. When we actually need to care about the patient, their well-being. It says right here, one of the points that is written in the Hippocratic Oath is right here. Let me change color right here. It says right here, work for the good of the patient. That means that whatever we do for our patients, it has to be for them, not for our own benefit. Oh, I'm going to be taking care of this patient. I'm going to tell them that they have this and that because, hey, I'm going to make some money. The patient doesn't know any better. So I'm going to diagnose you then with this. I'm going to send you to do all these procedures with no need. The only need is the interest that has this person to make some money out of the patient, putting the patient on all these situations, including financial burden. So this is working for the good of the patient, telling the patient exactly what's going on with them. not trying to take advantage of the situation because they don't know medicine. And it happens a lot. There are lots of lawsuits due to this at this time and era. People ordering tests that are not needed because that's how the medical doctor makes money. If the patient just comes there and says, oh, well, I have this and that, and says, oh, that's not a major thing because it's not, and sending the patient home and telling, some changes that might be done, social changes like no smoking, not drinking, doing exercise, not eating this or that, but instead they send you for all these procedures that are not needed. Are you working for the good of the patient? No, you are not. You're working for your own good, your own benefit. So that's what it's trying to tell you right here. Do the patient no harm? This is something that it runs across the medical field. It's a very common question in examination. What is it that the medical providers, when I'm talking about medical providers, I'm talking about everyone who takes care of the patient. Anyone who is involved with the care of the patient. You are. Everyone who handles any information from the patient. It is involved with the patient's care. So it belongs to all of us. So the most important thing about the Hippocratic Oath is to do no harm. That is the mission of every single medical professional, not the hospital. Because the hospital is just an entity. We are the ones who are dealing with these issues. We are the ones that are communicating, doing or not doing something for the patient. So our job is not to cause no harm. And there are many ways that you can prevent that. Giving the right information, communicating with them. When they call and they tell you that they need to see the doctor, ask what is the reason for. It might be an urgency or an emergency. Unfortunately, things have changed, and we more worry about asking first what medical insurance you have because that's what's going to pay for your bills versus what the patient really has. Prescribe no deadly drugs. What it's trying to tell you is do not overdose your patient. Do not give the patient medications that the patient doesn't need. These are deadly drugs. Or give the patient medications to terminate their lives. Remember, that is called euthanasia. Even though the patient asks about it. These are legal issues. We will talk about that when we get to medical law and ethics. The doctors have been doing that for a long time. When they see that the patient has a terminal illness, well, the easy way out is to give them a little dose of something so the patient can just die. And they don't create any burden for the practice, for the hospital, for the nursing home. So we need to make sure that none of these things are happening now that we are part of it. If we are not doing it, we are not going to form part of it. Remember, give no advice that could cause them death. So don't tell a patient that they need a surgical procedure when they actually don't need it. They might die during the procedure. You're going to cause more harm than good. So that's basically what all this Hippocratic Oath is about. Cause no harm to your patients. And all these things causes harm to the patient if you don't follow them in the right way. Keep confidential medical information regarding your patients. You should not divulge, spread, release the information on our patients without the patient's prior authorization. Patient needs to know if this information can be released or not. We will talk about that when we get to the part when the patient has to sign a release of information document if his or her information needs to be released. See, back in the days, there was no such a thing. There was no documents that the patient needs to sign. Oh, you know what happened, right? So I forget all the time this battery problems. Oh my goodness. Okay, so let's continue with this chapter. Oh, let me see. I think that I have this chapter twice. Okay. Can you guys see the PowerPoint that we were working on it? Yes?
Oh, I can't see it.
No? Let me see. Uh, uh, Now, Okay, thank you. My apology again. This is happening all the time. This computer, I don't know. Try to fix it, but it doesn't work when I fix it for the timing of the battery. Anyways, I'm gonna keep it connected. That's the only thing I'm gonna do for now. So let's move on to see. Remember, this is the Hippocratic Oath. Pay attention to it. Remember, a couple of questions from here. Who's the father of medicine? Hippocrates. And what is the main guidelines about the Hippocratic Oath is to do no harm. Remember, to do no harm to our patients. We were talking about keeping medical information confidentiality. We're going to talk a little more in detail when we get to medical records, because that is the part that is going to address this topic in a little more details. But for now, I'm just giving you an advance, because remember, the more that we say it, the more that we practice it, the more we go about these terms, you're going to remember it a lot more. So patients' personal protected information. So that's what we call it. Every information that is being disclosed to us, is being confided to the medical personnel, which is any one of us that works in the medical field, needs to be kept confidential. We should not release the patient information to no one without the patient's proper authorization. They have to sign the document. It doesn't matter who they are. Oh, the husband came over and is asking for the wife's information. Can we give it to them? No. The son, the daughter, the grandparents wants to know something about someone else. No, it doesn't matter how related you are. In order for us to do that, the patient has to sign a document, and the family members need to ask the patient, hey, I need to know your information, just in case something happens. Okay, I'm going to authorize you. So they're going to come to the office and fill out an application, a form that is called release of information. And this release of information is going to be assigned to someone in particular. If it is the son, the one who wants to know something, the name of the son needs to be there, the name of the daughter, the name of grandparents, any siblings, anyone, the husband, the wife. You can just come to the office and ask information about your patients. It doesn't work that way. If you release information and this information was supposed to be kept confidential, and then the patient sues the office for this, you're going to pay the price. So whoever did release this information is going to pay the price. $200,000 fine, 1 to 2 years in prison. Oh, now things change, right? It's not like things are going to stay like that. No. So this is a very, very serious matter. So I'm giving you all this in advance because these are questions for exams. Can release the information. In order for me to release information from my patients, I have to have a prior authorization from the patient. And this patient needs to tell to who, in which information should be released to this person, and what is the purpose. That's what the document says. It is a form, it is a template that we use. Now, if the patient decides to do that, the patient cannot sue the practice for any information that is released due to the fact that someone else has this information. Remember that the family members, they talk to people who are not authorized to know things. I mean, the patient thinks that this is affecting them personally, socially, financially, psychologically. They come and try to sue the business. But no, they cannot do anything because you sign a document authorizing this person. So it's not just the medical personnel that knows the information. Someone outside from the office know it. How can we control that? If they spreading the information to other people, that was your responsibility because you authorized this person to get the information. So you see how important it is for us to have documentation, to document everything that, every encounter that we have with our patients, we have to document it, regardless of what it is. So we need to have documentation because in the court of law, that's the only thing that works. Documentation, proofs. You have to have a proof that the patients sign a release of information. So now we're not responsible. So that's how it works. These are the organizations that are keeping an eye on the medical field, on the medical industry. They are not directly attached to the hospital, to any hospital. They don't own it. They are not the boss. But these are organizations that controls what happens in the medical field. The first one is the National, the World Health Organization. This is called WHO. This organization is very important because you see, this is question for exam. That's what is so important. It says right there, the World Health Organization. So this is the organization that regulates, that inspects every single organization in the world, every single country. They make sure that they know what's going on. What's going on with all these conditions, whether it's endemic, what is the pandemic, how that affects globally the human beings. That's basically what it is. So whenever the COVID, was when we have the COVID, well, the World Health Organization intervened. This is the one that gives us the statistics from every single country, every single state, every single town, every single village. How many people were infected? How many people went to these hospitals for help? How many people died? What age they died? Whether it was male, a female, whether it was a child, elderly, whether they have good conditions. This is the organization that keeps all the medical conditions existing in this time in the world. Every single medical condition, they know it. They have data with all this information, past medical conditions, current medical conditions, things that probably are going to happen because of information that they receive. That's why they create the international classification for disease. All these diagnostic codes, all these coding systems, all these ICD coding is international classification of disease, has to do with all the conditions, all the diagnosis, all the things that affects the human beings. And we create numbers to replace those conditions, codes that are international recognized. So we have a code for diabetes here in the United States. If you go to Italy, it's the same code for diabetes, the different types of diabetes, the same conditions, the different treatments that we have, same codes for those, different procedures, same codes for those across the world. It's not that you go to another country and they have a different diagnosis code for cancer of the colon. No, it's the same diagnosis, the same codes. Now, the treatments, of course, they varies from country to country. But they don't have the same type of medications. They don't control that. They control they keep the statistics of all these conditions. And that's why we have the international classification of disease based on all these statistics that this World Health Organization, which is called WHO for shorter, so all the information from every single condition, who has it? The World Health Organization. Then every single country receives those conditions, these new treatments, and then create those codes. So everybody works in the same pace. So that's basically what it is. Very important. Can you imagine that you move to another country and then your medical records is not good for anything? Not because of the language barrier, because it might not be written in Spanish, in Portuguese, in Urdu, Punjabi, Chinese, who knows what language, but because the codes are the same. So that's what's important about this World Health Organization, the CDC, that we're going to talk about next time. All these things are very, very involved with medical, with healthcare. That's what it says, the national view of healthcare. I will say the international view, not national, because all this is an international level. This is the Department of Health and Human Services. As the word implies, it is a department that has to do with the services that we provide to our patients and how we can protect them. Because remember, not every single person in this country went to the university to learn medicine. So we have a department who kind of oversee what's going on with the health industry. They have to do with all these governmental insurances programs like Medicare and Medicaid. Because we are familiar with those. We heard about Medicare and Medicaid. Later on, when we talk about medical insurance, we're going to talk about what is the difference between Medicare and Medicaid and what branches from these particular programs. What other insurance companies that depends on these Medicare and Medicaid? What type of insurance are those? Remember, we have private, commercial, governmental insurances. It's not just one type of insurance, and each one's have different regulations. But this Department of Health and Human Services is making sure that the patient receives the services that they deserve. That's why they create all these programs that are paid by the taxpayers. So that's basically what it is. They do not interfere directly with commercial or private insurances, but they do have a say on how these services are provided, because it's across the country. This is more in a national level. Centers for Disease Control, we heard about this during the pandemic. Well, they mention everything else as well, whatever we have mentioned already. WHO, the World Health Organization, was mentioned all the time. The Department of Health and Human Services, that was mentioned all the time. The Centers for Disease Control, all the time, but we hear about these more than the others. So this has to do with the safety of the people that receives healthcare in these organizations. So this one also on a national level, they keep it statistics of all the new conditions, all conditions, every single medical condition, a national level. They use these researchers or research department to gather all that information and to make sure that they know what condition is it, how to treat it, how to manage the condition, and most importantly, how to prevent the condition. When we talk about prevention, we're talking about vaccines. Remember that within the COVID, the CDC was involved immediately. Why? Well, not only WHO, the CDC as well, and every other organization, because they have to come out with a fast medication, a vaccine, so they can provide to the people who weren't infected yet, so they can prevent them. This is a preventive measurement. So all these organizations have an important function within the healthcare industry, but they work alongside with other organizations. Think about the systems during anatomy and physiology. Yeah, it's a body, but that body depends on all these systems. And these systems are made of these organs, and these organs are made of these tissues, and all these tissues are made of from all these cells. So from the smallest structure to the largest structure that is the body, it is controlled by everything that is going on inside. Well, these organizations are not different. They work in conjunction to better the health of the population that lives in that particular area that is being affected, or for the entire country. So that's the CDC, very important. So these are the ones that do the research to figure it out, what's causing the condition, how we're gonna treat it, how we're gonna prevent it, how we're gonna save more lives. Remember, the prevention is better than, curing someone, if we can prevent it. So every single vaccine is being studied, it's being developed due to all these investigations that the CDC department does to better the health of the population of the country. So they are continually working for that reason. So the CDC is a very, very important organization. So if you have a question about the CDC, that will be mostly about all these research that are going on to investigate what is the condition, how to treat it, to prevent more people, suffering from these conditions. Very important CDC. National Institute of Health. Now, like any other organization, remember, sometimes they branches off, they have departments. So it says that this is a division of the Department of Health and Human Services. Once again, they spend most of the time doing research, particularly medical schools, alongside with hospitals. Remember, we use all the data from the patients because for research, we can use the information from the medical records from the patients without involving the patient's personal information. We just need data from their conditions. Let me explain you this. When we use the information from our patients for research within the medical, we remove patient's personal information. What is patient's personal information? Names, date of birth, phone numbers, emails, addresses, anything that relates to the patient that can be identified, remove it. The only thing that we need to know is what condition. And that's what WHO does. We don't send information. When we collect statistics, we just send the information to the CDC, and the CDC relate this information to WHO. But the information that lives and goes to this organization is just information that does not contain patients' personal information. For instance, we diagnose millions of people with COVID. Millions of people die from COVID. We're going to send this information. Each hospital, each town, each country, each state, whatever you want to see it, they're going to summarize what happened in their state, and they're going to send this information to the CDC, and the CDC is going to report this to WHO? The World Health Organization. But the information that is going to send is how many people died from COVID, what were the genders, it was males, females, what was the age range, without mentioning names. Nobody says, oh, such and such person that lives in this place at this. No, there is no personal information involved. Only the condition. Whether they die, how many were dead, in which city, in which town, in which hospital. They just need statistics. What was done? What was the preventive measurements? How many medical personnel died or suffered from this pandemic? Everything, anybody who was affected. How many vaccines were created? How many dosage were needed? How many dosage were used? Who responded better to these medications, to these vaccines? Who didn't present signs and symptoms? Who were the most affected? Based on gender, age, location, geographic location. That's what we do. That's what National Institute of Health has to do with. Every single time that a patient dies in the hospital or dies wherever they die, they are brought to the hospital. There are some analysis, some tests done to find out what the patient died from. That is sent to the CDC. Once again, not the name. Oh, this person died. That will be sent in a different way because it has to be removed from taxes, from liabilities, and something. That's a different issue because we need to know how people die and with names, but that's not related to medical. How many people was born in the country, per state, town? How many people were born with mental conditions? How many babies were born with C-section, normal vaginal delivery? How many die after birth? How many stillbirths? How many pregnancies? How many miscarriages? How many abortions? All that is documented, but without mentioning who had this particular abortion, miscarriage, condition. How many people has been diagnosed with diabetes, hypertension, cancer of any kind? All that it is done by the National Institute of Health, and they send this information to the CDC, to the World Health. That is basically how it works. So all this organization works in conjunction. So it's important for us to understand how the system works. There are certain conditions that we need to know who has it. Not name per se, it's just to see what is the gender, what is the age, because we're going to start taking measurements to protect that particular population. That's why when the patient comes to the medical office, we ask a bunch of questions. We ask family history. We ask social history to see what is it that they're doing. Maybe whatever they're doing is what's causing this particular condition. And having all this information on hand is going to help us to properly diagnose our patients, properly treat it, give medications. Without this information, we wouldn't know how to treat patients. This is like every single time that a patient comes in, we don't know what's going on. No, but we have all this information, all this data from other patients from different parts of the world. That's why we keep this international classification of disease, because it's the same diagnosis for the same condition. So we can work in an easy, the way that we diagnose. Let's move something a little easier than that. Types of healthcare facilities. Remember, anytime you have a question, please let me know. So hospitals. See, everybody heard about hospitals. But there are some hospitals that are private, meaning when it says private means they don't receive funds from the government to operate. This is their own money. So usually the government don't have much control of it, because these are for profit organizations. Each hospital has within lots of specialties. That's basically what it is. So when you go to a hospital, they have all these medical specialties there. most of them. You want to go to the dentist, it's there. You want to go to the cardiologist, it's there. You want to go to the gastroenterologist, it's there. You go to a pediatrician, it's there. Orthopedics, chiropractic, you name it. Oncology, surgical doctors, inpatients, outpatients, family practice. You're going to find all these specialists within the hospital. But remember, we have doctors' offices that they are specialized only in one field. And then we have to refer you to another specialist, whether it's an independent specialist or whether it's a specialist that works within a hospital. Once again, as I mentioned before, some of these facilities are for profit, meaning you're just making money. Non-for-profit organization does not imply that they are not making no money. These are these organizations that are funded by the government. So the government every single year have certain amount of money that they decide that it is for the healthcare. That's the same way that they put aside money for education. And for many other things, security. See, non-profit organizations makes money, but that money must be reinvested back into the facility because that money is not theirs. That's the government money, that's the taxpayers' money. So people cannot say, oh, well, we received this much money, we're going to split. No, that would be for profit organizations because they're using their own money. That's what they're talking about here. We have acute care hospitals. That means emergencies. Acute is something that happens now and it doesn't last too long. Let's say less than 2 weeks. If it is something is less than 2 weeks that you have a developed condition and in 2 weeks it's gone, it's over, that's acute, but mostly something that's happening now. Why? Because we have some other conditions that are for people that are chronic conditions. So acute conditions, sometimes they can kill you. So you have a heart attack. That's an acute condition. You have trauma. You were hit by a car. That's an acute condition. Anything that happens, you are intoxicated. You need to go to the acute care immediately because it has to be taken care of. It's an emergency. But if you are diabetic, that's not an emergency unless you're having a diabetic comatoacidosis. That's a different issue. Your blood sugar went up to the roof. Oh, you're definitely going to die. So that is an emergency. But just being diabetic is not an emergency. Just having arthritis is not an emergency. Having some type of cancers is not an emergency. That can be treated. So those are the things that I want you to understand better, acute and chronic. Remember, chronic, as the word implies, is a condition that you've been dragging for a long time. So let's say, for instance, the patient goes to your office and they tell you, oh, my blood pressure is high. I feel like my heart is coming out my chest. And then during evaluation, the patients, you ask them, Do you have a history of hypertension? They say yes. Okay, so the patient has a chronic condition. It's just having some symptoms related to the condition. Do we have to take care of them? Yes. Do we have to be a little more proactive with these patients? Of course, because that can lead to a heart attack or something else. But the hypertension per se is considered chronic condition. It's just the symptoms that you're presenting now are considered acute. You are asthmatic. Well, yeah, because you're asthmatic, you're not going to remain in the hospital all the time. This is a chronic condition. But when you have an asthma attack, probably you're going to end up in the emergency because that can kill you. That is an acute episode. That's what some people call a flare-up. So acute and chronic, very interesting terms that you should kind of keep it in the back of your head. So hospitals, remember? Now we have hospitals, but we have these specialty or teaching hospitals. That is a totally different issue. Well, they are hospitals. They conduct all the services that a regular hospital does, but they have something else. They train people. How do they train people? Well, this hospital, you have all these interns, all these residents, medical doctors that are doing their internship. It's like when you finish this, you're gonna do a internship or externship, whatever you may call. So you're still working on your medical assistant program. So that's part of the training, part of the program. So you're gonna go now practice in the real world. Those are teaching hospitals. So that's very important that we know that there are certain hospitals are teaching hospitals because they have residents within. They don't have the obligation to receive residents, particularly when they are private. If they are funded by the government requires then that they should be also teaching hospitals. Not only medical doctors, but nurses, PAs, MPs, dietitians, any other professions might be allowed also to practice, to gain this training before you actually receive your license or certifications to practice on your own. So remember, all these hospitals have different departments. These departments can be outpatients or inpatients. You need to understand outpatients and inpatient facilities. Remember, inpatients is where you are hospitalized, when you remain in the hospital, that you've been treated there for days after 24 hours. Emergency is not considered inpatient. No, emergency, you go there and after they evaluate you, they send you home. If they now admit you into the hospital, you're no longer an emergency. Now you go into the ICU or the NICU, depends of the age. Now to some recovery department, whatever the case may be. So we need to be familiar with these terms. So if my doctor works in a hospital, I can go and visit my doctor and it's an outpatient visit. because I'm not gonna go there and get hospitalized. I'm not gonna be admitted. They're just gonna go there. Well, I'm gonna go there, receive my services, and then I go home. So most of the time, the rule of thumb for the difference between inpatient or outpatient is that if you remain more than 24 hours in a place, you are called inpatient. Less than 24 hours, no, it's outpatient. Another word for outpatient is ambulatory. Know these terms, know these terms. These terms are very important. They come in exams. It's not the same. An inpatient, when you read the questions, read the questions. You, as the medical assistant, are working in an inpatient facility. You have a patient that you need to draw the blood. What is the next step that you're going to do there? Oh, you're going to ask the patient's name. No, you don't do that. Patients that are admitted, they have a bracelet. They have a barcode. Now, if you are in an outpatient, now you have to ask the patient's name. Ask them to identify. What's your name, sir? And your last name and your day of birth. Patients that are hospitalized, we don't ask anything. They have an ID badge that we have to verify before we do any procedures to them. So if you don't read the questions correctly, then you're going to be misled. You're going to choose the wrong question. So that's why all these lectures are very important. Because remember, if you haven't been in the medical field, you don't know this. So you see the questions and you're just guessing. You know what is the worst part of a test? When you guess. Guessing is not good because you are not sure how you did. You're not confident. But when I'm knowing what I'm doing, it's a lot better. And with the process of elimination that I use 100% when I'm taking a test or I'm doing an evaluation for anything. So remember, outpatient, ambulatory is the same. Your doctor's office is an outpatient, it's an ambulatory. If you go to the emergency, it's ambulatory, it is outpatient. Emergency is not inpatient. Just because the emergency department is within the hospital does not imply that you are admitted. How many times have you gone to the hospital, to the emergency, and they don't admit you because you don't have something serious? They solve the problem right there and they send you home. Oh, but I spent more than 24 hours there. Oh, no. You spend too many hours waiting for being seen, but it's not the same. It's after you've been seen, you immediately come to me and I'm your doctor. I'm ready, not the time that you register. No, you register and you're waiting in the waiting area. That doesn't count. It's when you have been seen and you've been diagnosed. Mr. Miss Smith, you are diagnosed with nothing. You've been diagnosed with this. Now we're going to admit you, but not within the emergency. You're not staying with emergency. You already been admitted, even though if you remain in the emergency because the room, the department is not ready for you, they're keeping you there, but you're no longer part of the emergency. So you already been transferred. It's just that they're waiting for the room for you. But emergency, because these questions comes in exams, emergency is not an inpatient. It is outpatient. It is ambulatory. So think about that all the time. Oh, you went to the hospital to see your doctor and then The doctor diagnosed you with something and you went home. That's ambulatory. Think about your doctor's office. Your doctor's office are not open 24 hours. Now, urgent cares. Our urgent cares are in or outpatients or ambulatory? Ambulatory. Why? Because you don't get admitted there. If it's something serious that they cannot handle, they send you to a hospital. So be careful with these terms. Every single medical facility requires credentialing. Now, what is credentialing? Having all your documents, all your titles. What is it that you went to school for? Oh, you're a doctor. Oh, you're credentialed as a doctor. You're a nurse. Your credential is you are a nurse. We need to know, because we need to know whether you can work or not work in this facility, whether you can do this type of job or not. You go work and you apply in a hospital as a medical assistant, they're going to give you tasks that corresponds to a medical assistant, not nurse. They're not going to send you to give medications to the patient, because that's not part of your scope of duty. And your credential says that, because you're a medical assistant. If you're a nurse, you have a different scope of duty. If you're a doctor, you have a different scope of duty. You're a PA, you're a nurse practitioner, you're an anesthesiologist, you're a dietitian, you're a psychiatrist. All of them has a different job descriptions. Oh, you're a psychiatrist, but I'm going to send you to work in internal medicine. It doesn't work that way, because you are specialized in this particular branch of medicine. So that's exactly what you're going to be doing. So that's credentialing. And this country asks for every single credential when you apply for a job. Depends on the job that you apply for. And you have to be qualified for it. And you got to go to an interview. You have to show certificates, licenses. And they're going to verify if these certificates, these licenses are legit. So that's how it works. Here is my classes is not just mentioning, oh, hospitals, urgent cares, doctor's offices, nursing homes, hospice, and blah, blah. No, because you're not going to learn anything. You have to learn something that tells you. When you apply for a job and you apply as a medical assistant, you're going to have a job description, and that's only what you're going to be doing. What your job, your training prepared you to do. That's why you have a title. And that's what you make this amount of money based on that training, those qualifications. Nobody's going to ask you, okay, if it is private hospital, if it is a hospital, if it is... No. They're going to ask you a little more details about the specialties. What the services that they provide. Because those are the most common things. Talking about outpatients, talking about inpatients. Because if you, once again, if you don't understand this and you encounter a question and you just go there thinking that, you know, you're going to get the answer, well, if you're not reading the questions, then you're not understanding the question. So you need to do that. Don't worry about much of anything else. You know what is a hospital. You've been in a hospital, whether you receiving services, you bringing someone else, or you just saw a hospital that is in your area. Who doesn't know about hospitals? We do. We learn now about all these urgent cares. Who doesn't know about doctor's offices? But what you need to know now is add a little more to it, which is, okay, this organization, this facility is ambulatory. It's an outpatient. Oh, here, just because it says hospital does not imply that it is inpatients. No, we have inpatients and outpatients departments within a hospital. So just the fact that you hear the word hospital does not imply directly that it is inpatients. No. I work in hospitals and I know how that works. And I know I work in emergency, I know that emergency is not an inpatient. So think about that. That's what I gave you a little more details about emergencies. Because emergencies are usually asked for exams for a lot of reasons. So for now, the take-home point from this is these facilities can be outpatient, inpatient. And you know what is inpatient? Inpatient is that you've been admitted. You must be admitted. You must. You come to this place, they do some evaluations as an outpatient, and then they said, we need to admit you, okay? You're gonna stay in the hospital for a couple of days. If it goes beyond 24 hours, you were admitted, period. Okay. So let's continue with credentialing, because credentialing is a big topic for this chapter. Now, remember that I mentioned here they talk, they use a different language, so to speak, different terms to explain something that I said. Said right here that this credential involves determining if an individual should have staff privileges. Now, what privileges are you going to be having? Well, all depends on your title. You're going to be able to do this or that. And every single person that works in a facility, in a medical facility, particularly in hospitals, you're going to be assigned an email and a password, an account. You're going to have your own account. So whenever you access information in the computer database for the patients, your credentials are going to be used. And whatever you do there, those credentials are going to be recorded. So they know every single time that you enter the system. And what is it that you do, what you did during that time? Those are the privileges. If you're a medical assistant, you're allowed to enter the medical records to get the information from the patient so they have an account for you. They're going to create an account for you. Someone else is kind of overlooking, seeing how many times you entered the system and what you did during that time. Whether something that was necessarily or something that wasn't necessarily to do. So you have to be very careful with this. If you're a medical assistant, you're allowed to open the medical records, to enter the patient's database, to document vital signs, measurements. Mostly, that's what you need to do. So your privileges are very minimal. Now, if a nurse enters, it's going to have more privileges because she or he is going to be able to check medications, to remove medications, to administer those medications. She or he is going to have access to these medications. As a medical assistant, you will not have access to it. So you're not getting into this part of the nurses. You're going to see the general information about the patient, but you cannot see the doctor's orders about giving this medication to patient A, B, C, or D, or discontinuing a medication, or starting an IV, or doing this particular procedure. You won't be allowed to see that because your credential are giving you certain privileges. Same with the doctors. The doctors have a broad access to the medical records. They can see what you're doing, what the nurses are doing, and what I'm doing. So it's very important that we understand what is the purpose of having all these certificates, because you're going to be granted some access to information from the patient, but it's limited, depends of what your credentials are. Those are called privileges that you're going to have. Any questions about what we have discussed? Little by little, you're getting a little more into this because this is some of the information is thoroughly new for you. As always, every single time that we start a new chapter, new material, you're gonna know some things, might not be sure about some of the things you're gonna be completely not like sure about it. You never heard about it. So if it is important, I'm gonna make emphasis on those points. If it's not, we're just gonna let it by. Accreditation. Now, hospitals, like restaurants, like buildings, now they are accredited. See, they are giving you great. I live in a building. So back in the days, this didn't exist. That the buildings, that the restaurants were graded, were accredited. That's accreditation. Why? Because if you don't meet the requirements, we are going to remove your privileges to see patients. We're going to close your business. We're going to penalize you. We're going to suspend you, just like a regular person that commits a crime. So hospitals goes through the same process. Well, of course, in different levels, right? So if you work in a hospital, you got to be prepared. Usually this accreditation that is done by the Joint Commission, don't ever forget this, the Joint Commission, because you are going to be asked which organization accredits medical facilities, particularly hospitals. It's not for doctors' offices. It's not for urgent cares. It's hospitals. And those hospitals that they are accrediting are those hospitals that are governmental hospitals, those who receive funds from the government. So they have a group of people that is called the Joint Commission that every 3 years they visit the hospital. Physically, they go there, they review the medical records, they review the credentials for the people that is working there. They review whether they have lawsuits or they have complaints and if they have been fixed or not. They review the facility. They see that you have all the things that are needed for conducting your business. They look at lights, exits, extinguishers, security, everything. They evaluate that in an event that something happens, is this hospital to respond to that, to a catastrophe, to any issue that might arise. Are these people prepared for that? And it's not that they just gonna interview the top ranked people that works there. No, they can stop you right there in the middle of the hallways, in your exam room, everywhere when you work, and they start asking you questions. They can ask you questions. So you gotta be prepared. Before these accreditations visits comes to the hospital, because they are announced, the hospital tell you, the hospital send you a memo, an internal message, whether by email, whether by text message, whatever, system they have to communicate the employees with this information. And they're going to say, okay, we are going to have the visit from the Joint Commission. That's a big, big, big event. Everybody's going to be alert. Everybody is going to be awake, because this is very serious. Because if the people from the Joint Commission do not approve certain things, you have to correct it with certain period of time. And if you're not correcting it, then they're gonna punish you by giving you a suspension, putting you in probation, giving you fines, or the worst case scenario, closing your business. They have all the right to do it. This is like an audit that they do to the organizations, these accreditations. So what is based on? Quality care, patient safety. That's what they review all. They're not gonna go review every single medical record. It's impossible. Can you imagine how many medical records a hospital has on their database? Many. They just select randomly someone to ask questions to see if they are prepared. Let's say, for instance, you're a medical assistant and the Joint Commission is having an audit on your hospital where you work. You are in your laboratory waiting for your patients, and then suddenly someone just, approaches you and asks you, okay, can you tell me what is the closest exit from this building in case of fire? You need to know what is the nearest exit. What is the extinguisher here? You need to know what extinguishers are. How do you operate an extinguisher? What type of extinguisher do this, or that? You need to know. So there are simple things that they're gonna ask you. But if you don't respond, you're not prepared, then it's not that they're going to give you the fine to you, it's the hospital. For any fault that anyone within the hospital made, they're gonna make responsible the hospital because they're not training you properly. If they review all these resumes, all these credentials, they need to be up to date. There is no expired certificates or license from anyone that is currently working there. They give you a hint for that. So when they're gonna have a visit, they're gonna let everyone know, okay, your certificate is up for renovation. You must have it renovated. Otherwise, they can terminate your job because you're gonna get them in trouble. So you see how important is all this? So this is the Joint Commission. This is the organization that gives or conducts accreditations in hospitals. Remember, hospitals. Doctor's office don't receive the Joint Commission. Urgent cares don't receive the Joint Commission. Small facilities, they don't. It has to be a hospital, and it has to be a hospital that is funded by the government. So that's how it works. So be careful with all these. Remember, if they don't meet certain criteria, they have lots of hits, lots of falls, they're going to be in trouble. They're going to be in trouble. So they decide what to do. So what I want you to remember is the Joint Commission, because this comes in national exam. Whether you are going to end up working in a hospital or not, independently of that, the exam doesn't know. It's just a general question for anyone, because you need to know what's going on within your organization. Not pretty sure, that was back on 2000 12, 13, something like that. That was all these hospitals that they were closing. They closed a couple of hospitals around here. That's because they didn't pass the Joint Commission. So if you don't pass that, it's like passing the exam. You don't get approved. That's it. So just make sure that you know the Joint Commission. So just explain you what it is, what to expect, where it happens. And usually that happens every 3 years. If you work in a hospital, that's gonna happen. I was in one of these accreditation at the hospital when I used to work as a medical assistant when I first started, when I came to this country. I was a little worried because my English was so bad that I was like, oh my God, if they ask me something, that's not gonna be good. Not because I don't know it, it's because I don't know how to respond to it. I was lucky enough that they didn't stop at my department. And it's not that thing that you try to hide yourself. No, because you cannot. People has to be in their jobs, in their position, in their location. During that time is when you have to be there. Not even breaks sometimes we took. Because at any time they can show up and they cannot find that department empty. Nobody's there. I was a little stressed out during that time. That was like over a month. It's not that they go for a year, for a day. No, they would never do anything in a day. That was like, yeah, like a month, something like that. And every day I was like, oh my God, tomorrow they're gonna come. They never show up for me, but I have other colleagues that they did ask questions. But they trained me. They told me they're gonna ask you this because they ask you things according to your position. Yeah. So that's basically what it is. So it's not that it's difficult. It was just a little apprehensive because of the language barrier that I have at that time. I'm just telling you, making sure that, see, I'm telling you this because being there, done that. So I know this can happen, particularly if you were in a hospital, because that's the best place to work. And I wish all of you get a job in a hospital, because that's where the money is. Okay. Any questions about the Joint Commission? Okay, so here we have ambulatory care. Remember that I mentioned it so much. Think about what entails which facilities. Remember, when we talk about facilities and healthcare facilities, as any of these offices where you have medical doctors taking care of patients, including hospitals, any facility. Instead of saying store, because this is not stores, because here is when we see patients, so we call facilities. So ambulatory cares might be just your doctor office, maybe one doctor, maybe two, maybe three, maybe four, many, but it's still considered an outpatient, an ambulatory. See, ambulatory means to walk, ambular. But what is it? What do you mean walk? Yeah, you walk in and out the office. You do not stay there. You're not admitted. That's what it means. Remember, this is not English. It comes from a Latin word. So that's basically what it is. So you have a bunch of doctors, only one doctor, some doctors that buys the practice, they have a partnership. You have a group practice when you have a different specialties. Because there are those places. So you can go to a doctor's office where it's only one doctor, it's a general medicine, it is a family practice, it's an internal medicine, it's a pediatrician, that's it. It is a dentist. They just have one doctor working there. It can be two or three. It can be a society, a group, a partnership. Remember, not every single time that you see two doctors, three doctors working in that office does not imply that they have a partnership. That is not the case. No, there is one owner and he or she hires the other doctors to work under them, under their facility. In order for me to know that it is a partnership is because they have the business together. They create society with them. That's basically what it is. Just because you see different doctors, different specialties, does not imply they have a partnership. No, that's not true. I can have a place and I can rent the spaces to other people, and each one is independently responsible for their practice. Oh, you're a pediatrician. I'm going to rent you this space. That's basically how it works. So in order for me to know whether this is a partnership or this is a multidisciplinary clinic, I need to know paperwork. But it's just for you to have an idea. The most important thing is that most of these practices are ambulatory cares, meaning these places open a certain time in the morning and close a certain time in the afternoon or evening. That's it. They close at night. Nobody stays overnight, except for the security guard, probably. So that's basically what it is. So here we have a bunch of ambulatory care centers, occupational health centers. Remember, occupational means these agencies, these medical doctors that works for the people who got involved into accidents, whether within the company or outside the company. So someone else has to pay for their medical care. That is called occupational. Remember, if you got into an accident or if you work in the workplace, then the medical office is not treating you. You go to a certain special department, which is occupational. If you have problems with not being able to sleep and you have insomnia or any of those, you're going to go to a sleep center. They're going to check what is the problem and they're going to see what treatments they're going to give you. Physical therapy, There are many physical therapists out there, offices, urgent care centers. I've been mentioning this all the time. Now pay attention because urgent care do not mix urgent with emergency or emergent. Urgent and emergency are totally different fields. So an urgent care is to take care of people who are not in this life of death situation. Oh, I have an issue, it needs to be taken care right away, but it's not life of death situation. That's urgent. Emergency is a life of death situation. So you go there because you have a very serious condition. Now, forget about the real world in which we live currently. People goes to the emergency for nonsense situation. That's not an emergency. I think that I mentioned this before. If you go to an emergency with something that is not urgent, or that is not emergent, guess what? You're gonna wait the long periods of time. Probably they're never gonna call you because you're gonna end up leaving. All depends on how busy the practice is in that particular. Now, are we gonna be taking care of you? Yes. But it was an emergency? No. Remember, emergencies are a life of death situation. I've been repeating this all the time because these are questions for exams. Emergency is totally different from urgent or urgency. You have the urgency to go to the doctor because you have this and that. You are coughing. You have a little fever. Do you need to go to the emergency? No, I go to the urgent care. Probably it's the flu, an upper respiratory infection. Probably you have asthma and you having just an asthma attack. They can deal with you in an urgent care. You have a little cut, they're just gonna put some stitches. You just twist your ankle. Oh, they're gonna put you there a cast. They can do that in an urgent care. But are you gonna die from that? I don't think so. Oh, you're having a heart attack. Go to the emergency. You are bleeding profusely. Oh, you were struck by a car, hit by a car. Stabbed, shot. Oh, you're gonna end up in the emergency. That's not an urgent case because this is a life death situation. Oh, I forgot my medications. So it's a weekend and I didn't have medications for Monday. Today, oh, the doctor's office is closed. I'm not gonna be able to get my medications. I'm gonna go to the emergency. Nope, that's not an emergency. So be careful with that. Dialysis centers. You go just to do your dialysis procedure, which is, clean your blood outside of your body because your kidneys are not doing that job. We talk about this during anatomy and physiology. And then after 3 hours, 4 hours, they're gonna send you home. Yes, you have to come back 3 times, 4 times per week, but you're not staying. So those are ambulatory. Skilled nursing facilities. If you're not staying there admitted, you just went there, stayed for a while, and then they send you home. It is an ambulatory. Assisted living facilities. Only if you go there and send you home, but if you stay there, things change. Remember, you have to stay there. You are admitted. Sometimes they call it ambulatory because even though if you are admitted, you are not being treated directly by doctors. They're just taking care of you because someone cannot take care of you at home. It's like nursing homes. But in this case, someone is being taking care of you. It's assisted living. So your family can come over, stay with you. They can bring you in to the time and then take you home at night. There are different variations of this. The point here is when you said ambulatory, think about these places when you go, do whatever you have to do there, and then you return home. So that's how it works. Types of healthcare facilities, physician's office, laboratories, diagnostic laboratories. See, all these are places where you can work. Why? Because you as a medical assistant know how to draw blood, how to collect urine. They need you to do certain procedures if they are needed. Home health agencies, that will go a little beyond that, but this is a healthcare facility. Remember, wherever they take care of patients, we're gonna call it. I'm not saying that every single place you can apply for a job. No, because these have other type of certificates or licensing for this thing. Medical supplies, that's a healthcare facility. Rehab. So this is just to mention some. There are many healthcare facilities. Large, medium, small, you name it. Medical practices. So this goes back to, remember, whether you have one doctor, whether you have more than one doctor, but they have a partnership. If you are the proprietorship of this facility, you are the only owner, you pay for it, you bought the building, you pay the rent, you're responsible for the payments or all the bills, and you are the one who collect the money from the patients. That is only one practitioner. Remember, partnerships, then you associate yourself with another doctor or other doctors. Now you split the profits, you split the bills, if you will, the expenses, the responsibilities. You do this, you're in charge of this, but at the end of the day, we're gonna split everything. That's how it works, that's partnership. Or they decide to give this percentage, depending on what is it that they practice, what is it that they do. That's a partnership. Corporations, those are just large organizations. So that's basically what it is. Titles of doctors. Doctors of medicine. That entails all these medical doctors that see patients, that they diagnose. Remember, general physician, family practice, internal medicine, they are cardiologists, they are all the specialties. They are doctors in medicine. Doctors are chiropractic. Remember, these are the ones who mostly deals with these patients who has traumas, trying to fix the musculoskeletal system and all that stuff. It's not an orthopedics, it's a chiropractic with these all exercises and movements and body rehab kind of thing. We have dentists, we have optometrists, podiatrists, and many others. We're not going to mention every single field, every single profession, because it's hard sometimes to go over everything, but you have an idea because these are the most common ones. So that's how we are going to do this. Let's take a break. This is 7:05. So let's take a break and we come back 7:35, okay? And then we continue with this chapter. All right? See you 7:35.
Okay. Thank
All
you.
right, thank you. Okay. So we are back after the break. So let's continue with this chapter. I hope you guys enjoy your break. Let's wrap her up with this chapter.
Okie dokie.
Okay. So let's talk about these licensed or certified professionals. So physician's assistants, probably you heard about these. They're called PAs for shorten. These professions, mostly you're not gonna be asked about professions, but I want you to know what is it. A physician's assistant is not a doctor per se, but they work under the supervision of a doctor. They can diagnose, they can prescribe, they do everything a doctors do. But they do not sign the medical records after they see the patients. A doctor who is graduated as a medical doctor and is responsible for you, is your preceptor, your director, they will sign this for you. So that's the only thing that makes the difference between a doctor and a physician's assistant. Remember, physician assistant is a great profession. It is 4 years profession. You come out with a bachelor's degree, and then you can move on. If you want to do master's degree, you want to do a PhD degree, whatever. But these professionals seeing patients, they diagnose, they prescribe, they refer the patients, they do every single thing that a doctor can do. The only thing that they cannot do is to sign the medical records from the patient. They collect, they write, they document everything, but they cannot sign out for the medical records, just like medical doctors do. So whenever a medical doctor sees a patient, usually what they do is they review everything. When it is completed, they sign at the end of the documentation. What is it that physician's assistants do? They pass this medical record to the medical doctor review it, and if they are agree, they sign. If they see any things that are missing or any discrepancies per se, they ask the physician assistant to fix it up, and then the doctor signs these medical documents. Remember, these documents, these medical record documents has to be signed within 24 hours after being seen the patient. So that's basically what it is. Nurse practitioners. Okay, physician's assistants can work in any field, anything. They can decide to be a pediatrician, they can decide to be a family practice PAs, they can be anything in the medical. As a medical doctor, not a dentist, no. Not an anesthesiologist, no. Only the medical field, just seeing patients. So they can do all these. Now, why I'm bringing this up? Because nurse practitioners can do what doctors do, what PAs do, but nurse practitioners can sign their own medical records. They're not medical doctors, but they can sign medical records. So what is the difference then? That nurse practitioners do not work in every single specialty because they specialize when they become a nurse in something. So let's say, for instance, nurse practitioners, when they're going to graduate, they decide whether they're going to be family practice. So you're only going to be doing family practice. Physician's assistants can change their mind. If I got bored doing this, I'm going to do that. If I got bored doing, that's what physician's assistants do. Physician's assistant cannot open a medical office by themselves. They have to have a medical doctor. Nurse practitioners can open an office by themselves. A nurse practitioner has to be a nurse first. And then to become a nurse practitioner, they have to practice at least 2 years in a hospital. And after that, they go back to the school for the MP, which are 2 more years. So those are the professions. Nurse anesthetics. Now, this is an anesthesiologist. Nurses can specialize being only anesthesiologists. That's it. They're not seeing patients. They just apply anesthesia during surgical procedure, and that's all they do. Registered nurse. These are the nurses that they just work as a nurse. It's called registered because they have a license. So these nurses can be 2 years nursing school or 4 years nursing school. So they can have an associate with 2 years, so they can have a bachelor's degree with 4 years. The more experience that you have, the more time that you do for the course, the better pay that you're gonna get. Licensed practical vocational nurses, or LPNs. They're a kind of lower part of the nursing. They are not nurses. They are not RNs. They are vocational nurses. They are not nurses assistants either. They can do the work of nurses, but they mostly work in nursing homes, they can work in hospitals, whatever, but usually they prefer to have registered nurses instead. Medical technologies is anything. You can be a phlebotomist. This is a medical technology. You can be an EKG technician. That's a technology. You can be a laboratory technician. That is a technology. Physical therapist. That's another thing. Respiratory therapist. That's another thing. So once again, all depends on the time that you spend in training. That's how you have different titles. The more time that you spend in school, the more credits that you make, then the higher the title is going to be. So that's basically what it is. So if any one of you is interested in all those things, you have an idea what is it that they are talking about. LPMs can do this vocational nursing. They can do it in 11 months, 16 months. But once again, they will not be making as much money as an RN because an RN is a registered nurse, which has more responsibilities, and it can work and can be the nurse in charge, the nurse manager, versus LPNs cannot be. Not for a nurse. An LPN cannot be, the boss of an RN. That's the word away. Okay, other licensed or certified professions, occupational therapists, cardiovascular technologies, diagnostic medical sonographers or technologies. Oh, well, these sonographers, they do X-ray technicians, paramedics, emergency medical technicians, EMTs. Remember, paramedics and EMTs are not the same. EMTs are someone who just go to the scene, picks up the patient, give this first aid, but they cannot go beyond that. Paramedics are a lot more, they have more training.
Mr. Hoya,
Yes.
I wanted to ask, if I wanted to do womb care, like burn victims, gunshot victims, stuff like that, what would I go to school for?
Well, there is no school just for wound care. You have to become a nurse or at least an LPN.
So RN.
Yep.
Okay,
I
thank
heard
you.
you last time you were saying that.
Yeah,
But
thank
my
you.
advice to you, if that's what you want, you should do the registered nurse, but the 2 years registered nurse, an associate, because 4 years is just too long.
Okay.
Because as a
Thank you.
licensed practical nurse, you're not allowed much. And mostly they want to keep you like in nursing homes, giving injections, giving
No, I don't want to
medications,
be.
cleaning
I don't wanna
the
be like
patients, but not actually doing the real thing with wound care. Okay?
Okay, thank
They're going to
you.
be dealing, the LPNs are going to be dealing with these bed sores and things like that. And that's not exactly what you're talking about.
Thank you, Mr. Hoya.
No problem. Okay. So dietitians, that's another profession. So there are lots of fields within the medical, lots. We don't even have half of the things that, that we can do in the medical. The medical is a very, very broad industry. So that's why we have so many opportunities working. It doesn't matter in what the level is. Everybody has opportunities. It's just that we have more opportunities because you can grow up with, you can move up to the ladder if you work in the medical field because there are many specialties that you can go for. Okay, so we just went over that part. It says right here, summary scenarios. Well, we're not going to talk about that much. It's just that what medical assistants do. Remember, you have an scope of duty. Later on, I believe we have something that it's going to explain certifications, licensings, and things like that. Remember, medical assistants are certified. They are not licensed. They are certified. You are not going to have a diploma. See, everything is based on the period of time and the level of training that you receive and the length of time that you attended your programs. So any program that spends less than 12 months is called a certification. You're gonna earn a certification, except for some other little things here and there, like the nurses aid, nurses assistants, CNAs, they receive a license because this is a different way of doing things with the patients. But for medical assistants, phlebotomists, EKG technicians, most of the time, these are considered certifications, okay? So now, what is the difference between certifications and licensing? It's not just what you do, the job that you're gonna do, but where are you gonna be working? So for instance, if you have a certificate, those certificates are a national level. They are a national level. So it means that you got a certificate as a medical assistant here in New York, and tomorrow you decide that you're going to move to Florida, to Texas, to North Carolina, whichever state within the United States. You don't have to take another exam. You don't have to go apply to get your certification approved in that particular location. No, it's going to work. You're going to say, oh, I have a certificate as a medical assistant from New York. Not a problem. Whereas if you are licensed are state only. So let's say that you have a license for something in this state, let's say a nurse, a doctor, a dietitian, and you want to move to Florida, my bad, but over there, you have to go through all this process of getting a new license. Depends on the policies that they have there, the accreditation or credentialing requirements. So you have to not to go back to school, no. But if they tell you here, you have to go take again an exam, a national exam, the boards for that particular program, you have to go do it. Medical assistants don't. But you just go there and you present your certificate and that's it. If you meet the criteria of the person that they are looking for, your credentials are not a problem. So that's basically what it is. Remember, licenses are state-wide. That's it. In your state, when you got that license, that's the state that you need to practice. Unless your state has some type of agreements with another state that is called reciprocity, that's a different issue. But there are few states that has reciprocity with licensing. So in general, what you need to know is that if you have a state license, you probably have to go through all these credentials, probably having to register again, taking an exam again to become a nurse in that particular state when you're going to be working, or a doctor, or else, whoever have a license. So those are the little kind of troubles that you encounter when, depending on the certifications and the licensures that you have. You probably hear people who comes from other countries. I know tons of people. They are doctors from different countries and they come here, they cannot practice. Why? Because they have a license. they have a license in a foreign country. Well, the rules, you don't even are allowed to go to another state and practice. Can you imagine someone from a different country? So just picture it that way. So licenses are very, very serious, and you have to go through all these credentials and all these requirements. Depends on the state where you wanna take your license or where you're gonna move to and use the license that you took in another state. So that's basically what it is. Okay, any questions? We're gonna move on for the next chapter. So this is the medical assistant profession. So let me give you this chapter right here. Chapter number 3 right here. So let's talk about now your profession. What is it? What you can do? Things like that. So it says right here, certifications for medical assistants, duties or your scope of duty in the medical assistant profession. We're going to talk about professionalism and certain organizations that give you your certificate. Remember that I told you that medical assistants receive a certificate. So we're going to talk about your profession. We're going to talk about what is it that you have to do as a medical assistant. And I'm going to tell you little things that goes from the real world as a medical assistant. And the organizations that can certify you after you finish your program at the school, then you are qualified to sit for the certificate in which organizations are there open for you so you can be certified. Remember, this organization has nothing to do with the school. These are independent organizations. So we will discuss all that. So the medical assistant program is a very, very, very fast growing field. So not only the medical assistant, all the fields within the medical are really growing very fast. So there's no way that you're not gonna find a job. Remember, after you get your education, you have your certificate of completion from the school that will be acquired or given to you when you finish your internship. Remember that you pass your internship. So your internship is part of the medical assistant program. So don't think that because you just completed all these modules, the lectures and the practicals, now you are ready to sit for the national exam. No, you have to complete your internship first. So because that's part of the hours to complete the medical assistant program. So you have to do it and do it, at your convenience, but make sure that the more time that you take to complete your internship, the longer that you get to take the national exam, and the longer that it's going to take for you to apply for a job as a medical assistant. So you have to take in consideration all these things. Sometimes it's hard, but try to do your best to complete this internship because internships are not done online. So some of you might have a little issue because you have a job, you have other responsibilities, but try to do your best just to complete it, and then you can qualify to take the national certification, and then you can apply for a job as a medical assistant. Just for you to know. The history of the medical assistant So the medical assistant, just like any other profession, they weren't called medical assistants, they weren't called doctors, they weren't called nurses. No, they just start doing the job because they thought that they knew how to do it. For the medical assistants, well, someone in the medical office needs someone, they receive a neighbor or they receive a family member, they train them on the job and they told them what to do. So that's basically how all these professions develop. Starting with doctors. There was no such a doctor profession back in the days. Well, that was very long ago, but that's basically what it is. So there were no schools for medical doctors. There was no school for nurses. There was no schools for medical assistants. Well, so there were no schools for doctors. Can you imagine medical assistants? They call themselves doctors because they just knew some stuff and they started using it with the neighbors, and then they get recognized for some things that they did good. But well, they weren't doctors. They didn't go for a proper training. So after that, things changed. Everything evolves as time goes by. So these medical assistant school programs, they start like in the 1940s. So that was a long time ago. Well, to be honest with you, I'm very old, but I wasn't born at that time. Okay. So that was too much though. So once again, and then keeping improving and asking for more requirements and so on and so forth, just like any other thing, just like technology. Remember, not long ago, we didn't have cellular phones. Now we have cellular phones, and the first cellular phones that we use are not the same as the cellular phones that we have now. Those cellular phones, you can barely talk on them, and well, now you can do just many things on your phone. So technology, time, everything changes, everything evolves. Well, the professions as well. Now we have tons of medical assistant schools, tons of colleges, universities for medical doctors, nurses, you name it. We went through all these specialties that we have. Well, we have schools for all of that. But remember, in this country, you have to have a certificate in order for you to apply for a job. Remember, that's called credentials. So if you don't have the appropriate credentials, you're not going to get the job that you wanted to. And if you don't go to the school and get the training that you want, well, without these credentials, you're not going to be able to work. So that is simple. Not like before, then you went to the doctor and says, hey, have some time off. Do you think that I can, give you a hand right there or lending you a helping hand so we can do this or that? Oh, they might say yes. Now, no, because we have all these rules and regulations. Remember, that is the problem. It's not that they don't want to train you. It's not that they don't want to give you the chance. It's not that they don't want to give you the job. It's like nowadays, for all these lawsuits and all these legal things, they just don't want to put themselves at risk. But if you have a certificate, now you have something that is going to, provide you can prove that you were trained on the field that you said that you're going to work on. So that's basically what it is. They're not going to ask you this anyways. The scope of practice of medical assistant, you guys can do a lot of stuff. As a medical assistant, a lot of stuff you can do. You can be in the front, you can be in the back. Remember, the medical facilities are divided into the front, which is all the administrative job, and the back, which is all the clinical aspects of the facility. Now, if you work in a doctor's office, you might do both. You're going to be answering the phones, you're going to be making appointments, you are going to be verifying medical insurance coverage for the patients. Plus, you're going to be doing vital signs, you're going to be drawing blood, you're going to be doing EKGs, You're going to assist the doctor with any minor procedures if that's what they do, or just translating or assisting the doctor with anything that they need you for. So you are very versatile. You have lots of knowledge, lots of stuff that you can do. So that's basically what it is. Now, if you work in a hospital, one thing that I can tell you for sure, you're not going to be doing administrative work. You're not going to be taking care of the patients in the front. You're not going to be dealing with phone calls. You're not going to be dealing with medical records. None of those. That will be done by other people that are specialized for that. You will be on the clinical part, on the back of the office. So that's all you have to do. I work in a hospital. Remember that I told you that when I came to this country, I started working in a hospital as a medical assistant. I did this course, 9 months, medical assistant, and that's the reason why I know everything about medical assistants, because I worked there. Then I became a doctor. Then I know the ins and outs. I know what you're supposed to do as a medical assistant. I know what the doctors do. I know what you cannot do. I know what the doctor is going to order you to do, and when you can do it, when you can refuse to do it. So I'm going to tell you how that works. So that's basically what it is. But yes, you're going to be learning a lot of stuff. There's a lot of stuff to do. Now, once again, all depends where you're going to have the opportunity. We're going to see right here that working in a doctor's office is going to be like, for me, it's like 80% of the time. According to the book, they said that 60% of the people who graduates from the medical assistant program will be working in doctor's offices or small practices, because those are the first ones that are going to give you the chance, because remember, you don't have much experience. But after that, then you're going to move on, and then you're going to start working in a hospital, because within the hospital, they want someone with experience. Doctors, because they pay a little cheaper, and they don't give you all these perks like, medical insurance. They don't pay you vacation. They don't give you overtime. They don't give you this. They don't give you that. They don't give you vacation. Nothing, no sick days. So because you're not going to have any of those, a hospital is going to give you all of those. But usually your first job probably is not going to be a hospital. I'm not saying for everyone. Hey, I was lucky. I was hired in a hospital right out of school when I was doing my internship, but it can happen to anyone. But most of the chances are within these small practices. So just keep it in mind and just gain the practice that you need, and then try to move on. So that's what I recommend everyone. And that's something that I was planning to do if I wasn't hired in a hospital. Well, to be honest with you, I never thought about that. I just knew that I want to work, and I was just doing step by step. I'm doing my internship, let's finish with it, and then move on to the next step. But I was lucky enough that in the first week they hired me, but that's it. It was me. Can happen to you, but chances are that, not everybody is going to be working in a hospital after graduation. But if you start working in a clinic, well, you're going to learn a lot. Why? Because you're going to be doing the front, the back, so you're going to get the 360 view that you need, so you can move on to a hospital. And even though if you're not going to do the front, because you need to know certain things from the front, because you're going to receive the medical record from the front desk, and they're going to tell you, oh, come here, you can call patient, I'll go to this office, and then you bring them and you open the medical records, so because after you finish, you have to bring the medical records from your place, from the doctor's office, from the doctor's room to the front. So you're going to get to know the ins and outs. So you're going to learn a lot. Working in an office is a a plus because you're going to be doing a lot. Now, when you move to a hospital, you're not going to do too much, but you learn a lot. So that's what is really important. So it says right here, medical assistants are found in physicians' offices, hospitals, surgical centers, urgent care centers. You can work almost anywhere where they need medical assistance. When they have patients that they have to do vital signs, that they have to do EKGs, and or any specialty. Remember, you can work with a cardiologist. Why? Because you learn how to do vital signs and how to do EKGs. So you work with them because that's what they do most of the time. They also order blood. You can draw blood. They also order urine. You can collect urine from your patients. So you are very versatile. So you definitely have this general knowledge about a lot of stuff that you can fit in any of these practices. So it's a good thing. I'm telling you that because I have students that I just teach phlebotomy, but itself. And you see, medical assistance is like an umbrella, right? Underneath, you have a lot of stuff that you can do. Phlebotomy is within the medical assistant. EKG is within the medical assistant. Vital signs is within the medical assistant. But if you only learn phlebotomy, the only thing that you can do, you apply for the labs. That's it. Because the doctor is not going to hire you just to do labs because they have other stuff to do. The hospital will hire you for that. An independent laboratory like Quest, BioReference, North Shore Labs, some other labs, LabCorp, they will hire you only with the phlebotomy. But you kind of narrowing all the opportunities. But if you are a medical assistant, you have most opportunities because as a medical assistant, I want you because you have all these extra curriculum that I can use. Instead of having someone who just do phlebotomy, well, if someone knows about taking care of the front, taking care of EKG, taking care of vital signs, helping me out with any procedures that I do in my office, I want you instead of having a person who did just one part of the medical system. Now, being a medical assistant and you got the opportunity to work as a phlebotomist only, well, you have the plus that whenever you feel like you don't want to work there, you work as a medical assistant. Oh, I got bored doing all with the same thing. I'm going to interact a little more with the patient. So then I want to work in an office where I have all the opportunities. So that's basically what it is. So in this profession, you have a broader spectrum of, tasks that you can accomplish. So that is good. Cross-training. So it says right here, many medical assistants are cross-trained to handle a variety of duties and to cover for others who may be ill or out of the office for various reasons. That is true. I told you already. It's what I explained already. That you know so many things, related to your program, your profession, your certification, that you can be covering, that you can be used, your knowledge can be utilized, not being used, but utilized. So you are more prone to get a job versus someone who just studied one thing. See, that's basically what it is. See, in a doctor's office, sometimes you have one medical assistant and you have to run the whole place. You actually have to open and close the office. So you are the office manager, you are the medical assistant, you are everything in that office. I've seen it. Seen many medical doctors that work like that. So now the medical doctors, they have two. But when one gets sick, one is off, one is on vacation, whereas the other one has to do cover. So then it is important that you know all these different tasks that you have to, accomplish when you are working in the medical field. So the more you know, the better. And I will definitely hire someone who's a medical assistant versus someone who just do one thing. Now, one of the things that I always recommend my students is like, if you become a medical assistant, I want you to apply also for the phlebotomy certificate. Yes, under the umbrella of medical assistant certificate, you can work as a phlebotomist, as a EKG within that particular job with using that credential. But sometimes independent laboratories, they want you to have only the phlebotomy. I don't care about your medical assistant. I know you're medical assistant, but I don't need you for that. I want to have a phlebotomy certificate. And probably you're gonna make money, the same amount of money as a medical assistant, or maybe more, because you're gonna go like in a specialization, which is just drawing blood, probably collecting urine and other things, but that's all you do. You don't deal with anything else with the patients. So they pay very well, because I know laboratories pay very well for that. Now, another thing, because things have changed, remember, I'm giving you the ins and outs of the profession, because that's the purpose of this class, not just to mention it. Oh yeah, you'll learn a lot of stuff, moving on. Yeah, you're gonna do this, moving on. No, I gotta tell you the opportunities that you're gonna have with this certificate. So with our lives that are so busy, because I know we have a life besides coming to school, right? You have work to do, you have family to take care of, there are a bunch of issues. So you're probably not gonna have enough time to do a regular job. Well, as a phlebotomist, you can have a job to go to the patient's home, to draw their blood, to do an EKG, probably collect urine, to do vital signs, and you're gonna get paid for it. And you're gonna schedule on your own time. And they pay you very well. So there is this like home visit medical assistants. And who hires them? Laboratories. But for that reason, not only being a medical assistant is good, but having the certificate as a phlebotomist reassures them that you do know how to draw blood. Because drawing blood is not something that you just say, oh yeah, I know how to draw blood. Because you're gonna have all these elderly patients that have these medical conditions that are a little difficult to draw blood from. But if you actually have your certificate as a phlebotomist, they think that you are better than if you just have the medical assistant license. I'm telling you that because I know people that have done that and gotten job this way. They pay very well, but one of the conditions is that you have to have a car. You have to have a car. Because you're going to move from one place to the next, and you're not going to be carrying all these tubes with blood, with urine, and the train and the bus, and you're never going to reach your destination. And you're going to have equipment with you. So you're going to have to actually have a car. That is a prerequisite. If you don't have a car, it doesn't matter. They're not going to give you the job. And they pay very well because they pay you for your time, your service, plus miles. They're gonna pay you for the miles of your car. So it's very good, I'm telling you, for those who don't have much time to get a regular job. So there are options. That's what I'm telling you. It is important that you get the certificate as a phlebotomist as well. That is if you want. It's not a must, but just in case you want to kind of have a more broader job opportunities, that's how you're going to get it. Okay. Any questions? So we continue with the scope of practice. Remember, because you spend some time within this program, 9 months is a lot. So you're gonna be learning things, remember, administrative task and the clinical portion of it. So you're gonna be learning a lot of stuff during this program. And you have up to now, because that's all we've been doing, covering all these chapters, and each one, even though if kind of correlated with other chapters, has differences. And then you know now how you are going to do your job, how you are going to delegate functions, or how your boss is going to delegate functions to you, because they know what your scope of duty entails. This is what you learn. This is how you are going to do things. Believe me, I always mention the same things. Remember, the office is divided in the front and the back. What is it that you do in the front? All the administrative tasks. Remember, answering the phones, scheduling the patients, registering the patients, entering medical histories, or collecting medical histories, entering patients' information in the medical records, whether it's paper-based, whether it's electronic. You're going to be doing that. You greet your patients, you tell them what is the reason that you're here, you check in for insurance, health insurance verification. All those things you have to do it. You're going to be doing referrals. It's a lot of stuff. So again, with all that knowledge, all these basic general knowledge, you're going to be, applying most of this information in your workplace. Because every single patient is going to come with a different condition, with a different situation. All the picture presentations are not the same. But with all the general knowledge that you're gaining in this course, you're going to be able to sort out some of the situations. And otherwise, you're going to have someone else you can ask to, but you have an idea. You know that part you don't know it, so then you're going to ask. But it's going to be a lot easier for you to understand when someone tell you, no, this is done this way, you have to do this. And after, you go through it a couple of times, now it becomes something that you know for now on. Things that you should not be doing as a medical assistant. You should not be giving injections, no medications, except for vaccinations if they train you to do so. Remember, there are certain things that you don't do. You don't do diagnosis, you do not prescribe. What I mentioned this, because you as a medical assistant, those are the things that you don't do. This is the job this is the doctor's job. And what do I mention it to you? Because these are questions for the exams. See, I always repeat the same thing. You're going to be doing EKGs. That's your job. Vital signs. That's your job. Assistant the doctor. Yes, that is your job. That's the name of your profession. Drawing blood. Of course. Collecting urine. Yes. And there is no moment that I have told you, okay, you're going to be diagnosing patient. Oh yeah, tell them, give your medical advice. No, you cannot do that. You're not going to be giving injections. You're not going to be giving IV fluids, intramuscular injections, subcutaneous injection, intradermal injection. No, no, no. Vaccinations are different. When you give vaccination to the patient, unless the patient is allergic to that medication, well, it's going to react to anything. But vaccinations, usually people don't get allergies to it. It's very, very seldom that someone develops. So for that reason, if the medical doctor or whoever works in that office is willing to train you to give shots or vaccinations, you can do it. Any other medications, you cannot do it. So whenever you see questions that they said, okay, medical assistants are allowed to do this, no, If it says giving medications, giving IV, giving medical advice, no, 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 giving diagnosis, no, 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 doing surgical procedure, of course not. You're going to be learning a lot of stuff in your workplace, but that should not be taken to the heart. Oh, because I heard this, because the medical doctor did this, now I'm going to do it myself. No, because you're going to get yourself in trouble because it's not part of your scope of duty. And we will discuss the consequences of doing something going beyond your scope of practice. What's going to happen when we go to law and ethics, medical law and ethics. So think about it. It's serious. So you have some type of training, but to do certain things. And who wants to do more for the same pay? Come on. If you give me to do something else, hey, increase the payment then. But you're not going to pay me more, but you give me more work. No. And you got to be very careful, not only with the doctors, with the nurses. Because the nurses sometimes, they want you to do things. They tell you. But who's going to get in trouble? You, not the nurse. The practice, the medical doctor, not the nurse, is you and the practice as a whole. So that's basically what it is. So don't do anything that is not part of your job description. That's basically what you have to do all the time. Be familiar with it. And I've been repeating this over and over and over. Can you verify patients' insurance, medical insurance coverage? Yes. Can you enter vital signs in the patient's medical record? Yes. Can you give diagnosis? No. Can you prescribe? No. Can you give medical advice to the patient? No. Can you give in medications to the patient? No. No medications, no medications, no medication at all. So knowing those things, listen, you're safe. And these are the type of questions that you're going to get in your exam. Because see, the purpose of the exam is not just knowing how much you know about the subject matter, but it's knowing that you're not going to get yourself in trouble and you're not going to get the medical professional in trouble. Because if you don't know what you're doing, then this is exactly what you're going to do in your workplace. You're going to get yourself in trouble, and then you're going to get your boss in trouble. That's the reason why they test us and all these things. So most of the questions are kind of common knowledge. Think about it. Sometimes we say it's common sense, right? So here are the two groups, branches, sections, whatever you want to call, of a medical assistant. Remember, I mentioned this before. You're going to be doing the clinical aspects or the administrative tasks. If you're dealing with medical records, documentation, appointments, checking insurance, billing, any of these, receiving a patient's complaint, all that is administrative. Calling the patient, receiving payments, administrative. That's it. If it is clinical, then you talk about vital signs, drawing blood, collecting urine, doing an EKG, assisting the doctor doing a pap smear or any other procedures that they might be doing in your office. That will be clinical. So that's basically what you need to understand. So if you know these two parts of the medical office and you know which task you are entitled to perform, then you're going to be fine. Anything that goes beyond this, regardless, just because the doctor asks you does not imply that you can do it. See, these doctors, they're not like me. They didn't go to medical assistant. So they think, oh, well, medical assistants can just do giving injection. Go Can you give an injection to this patient? Oh, yeah. No, even though if you know how to do it, you shouldn't volunteer to it because it's not part of your scope of duty. And that's what the nurses do most of the time. They want you to do their jobs. And then you get in trouble because how are you going to defend yourself? What will be your excuse? Oh, the nurse asked me to do it. Oh, seriously? So if the nurse asks you to jump from the 20th floor building, you're going to jump? Oh, no, oh, no, it's the same thing because now you're in trouble. And now you want to jump from this building because whatever is going to happen to you is really bad. So remember, if you are not doing, you're not following, your scope of duty, you're going to get in trouble and you're going to get in trouble your boss. See, the least that can happen to you is that you're going to get fired. Who wants to get fired, please? Particularly when I just graduated from my school. I'm just learning this. I just earned my first paycheck. No, we're going to do things the way that they are supposed to, regardless. I will show you, I will tell you, how you're going to handle situations when a doctor or a nurse asks you to do something without pissing them off. Remember, you have to be very, very careful how you talk to these people when they ask you to do something that you are not supposed to be doing it. No attitude. So we will discuss that later on. And so here it is. See, we have the front desk right here. Everything that happens within the front desk, within the waiting area, that will be the administrative part. That includes the environment of your office, the lighting, whether they have magazines there to entertain the patients while they're waiting to be seen, TV, whether they can have funds or they can eat or not, that's part of the administrative part. And the clinical part, this medical assistant, let's assume that is a medical assistant, is doing vital signs. Remember, vital signs has to do with pulse, respirations, temperature, blood pressure, pain management, maybe oxygen levels. All that has to do with vital signs. And then you do measurements, which are height and weight. So that's basically what it is, height and weight. So just picture yourself when you go to the doctor's office. And that's how you're going to remember these things. Because I know you've been in a doctor's office more than once. Oh, believe me. Just because of you, because you brought your child over there, a sibling, your parents. But we've been there in medical offices. So when we go there, just now, you're not gonna be the patient. Now you're gonna be the person who's gonna be behind the counter, behind the desk, taking care of this person that is going to complain about something or is going to need your services. So that's how the whole thing, develops. The clinical duties. So first, we're going to talk about what is the clinical part that you're going to be doing, even though if I mentioned them. Like in medical histories, well, some of the doctors might allow you to fill out a formulary, a form for the patient. Sometimes we ask the patient to complete it, but you kind of, assist them when they're doing that. But you ask some questions sometimes. They would think about medical histories is done, most of the stuff nowadays is done in the computer. And you have a pull down menu when you just select things, or you just give them a form in paper if it is paper based. So regardless of the way that you collecting the histories, is just to ask more likely, what is the reason of for your visit? Can you tell me what is the reason your visit today? How can we assist you with? Oh, I have this and I have that, or I'm here for this or that. So that's not the complete history, of course not. It's just that if the patient tell you that they have this, you have to ask a little more questions to it. Particularly for how long it's been going on. Have you taken anything to relieve the pain? Is this the first time that you're here? Are you a new patient? So a lot of stuff. Do you have this medical condition? Have you had this before? Explain treatment procedures to patients. Now, be careful with this because this is not that you're going to diagnose the patient. Now you're going to tell them what treatment or procedure they're going to go for. No. This is after they have spoken to the doctor have explained the treatments, procedures, referrals, then you are going to reassure these patients about what is it that they have to do. Okay, you're gonna take these medications, you're gonna go to the pharmacy, pick up these medications. Remember, these medications you have to take it before meals, after meals, before going to sleep, with food, before meals, with water. That's a different issue. You're reassuring something that the doctor has already explained there. It's not that you're gonna take this upon yourself and start explaining to the patient, okay, I'm gonna give you this. No, because now you are diagnosing, treating, prescribing patients. No, you don't do that. Or just giving them instructions. Oh, the doctor wants you to come back this day. You have to be fasting, and fasting means you should not have anything to drink or eat 8 to 12 hours prior to the test. So the day before, or this test is gonna be in this day, please do not eat or drink anything 8 to 12 hours prior. Oh, you have to do this test, you have to do this, or you have to do this preparation. You have to explain it ahead of the time. And then give them written instructions. Written instructions in the language that the patient speaks. Because if you gave me written instructions in the language that I don't speak, this is like you didn't give me anything. And remember, the things that you tell me, I'm not going to be remembering them as soon as I leave the office. Actually, when you were explaining those things, I didn't understand anything. That's what we give the written instructions. I'm going to talk about, feedback when explaining when we get to patient's communication. So this is a very, very important subject. I like this module because this is mostly interaction with your patients, direct interaction with them. You are more involved with the patient than when you just go draw the blood, because here it's like communication all the time. You are interacting with the patients continuously. So that's very important. Preparing patients for examinations. You have to prepare your patients. You're not going to be doing the exam. You're going to be preparing. But yes, you might be doing some exams because you might prepare them to do an EKG. Remember when we do the EKG? You can explain the patient what's the procedure, what they have to remove, how they have to put the gown, how they have to, lay down on the bed. not to move, not to talk when you're doing the procedure. So you're preparing your patients whether you are going to be doing a procedure or if the medical doctor or the nurse is going to be a procedure. So you got to get ready your room. So the room got to get ready. You got to be clean to not have bad smells or odors. Depends on the procedure. You have to have ready the equipment, the supplies, the instruments, whatever they're going to use. Because you are assisting the physician during these examinations, which is the next item in this list. You got to be prepared. You got to make sure that you have everything that is needed and more to know where the things are, just in case. See, you're going to do pap smear. You got to get familiar with, when we get into these procedures, you got to get familiar with the types of speculums that you use. They're small, medium, large, extra large. When are you going to prepare these? Are you going to bring all of them into the table? I don't think so. So you got to be prepared because you're gonna know when I'm gonna use this small, medium, large, or extra large. What other things do I'm gonna need? Where I'm gonna find them just in case the doctor says, no, I need something else. You need to know, you need to be prepared. Collecting, preparing laboratory specimens. Nowadays, things have changed a lot. Remember, everything evolves with technology. Back in the days, if the doctor was going to evaluate within the office, use the microscope to check blood and to tell you what is the hemoglobin levels, and that was a pain. I remember that. Then you had to prepare the slides, you had to prepare the microscope. That doesn't happen anymore. Thank God. Because now everything is sent to an outside laboratory if you work in a doctor's office, or to the laboratory that belongs to the hospital. So that's basically what it is. So you might be collecting blood, urine, stools, sputum. Certain things you are allowed to do, other things you are not allowed to do. So think about that. It says right here, performing basic laboratory testing. Yeah, pregnancy test, very basic. Hemoglobin, very basic. Glucose levels, very basic. Some dipstick urine, very basic. You just do it right there. You actually can get the results and give it to the doctor right there because you don't have to do much. We have these devices that, gave us the results. An EKG, see? You do an EKG, you print out the results, you give it to the doctor. That is laboratory testings. Here we have again, instructing patients about medications and special diets. Now remember, all this information is given later on after the patients have seen these patients, after the doctor has seen these patients. So you're just gonna reassure the patients any medication that I'm giving to the patient. Special diets, meaning what to eat, not to eat, and the reasons why you shouldn't be eating because the doctor have explained it. Remember, this is what happens when the patient comes to the office. The doctor, because I experience this a lot. You ask the patient, do you have any questions? No. Is everything okay? They just nod. Yeah, everything is fine. They don't ask you questions. But as soon as they step out the doctor's room, because I always say the doctor's office, no, that's the entire facility. But let's put it this way. Simplify everything. They leave the exam room and they said, go to the front, ask the medical assistant or the nurse over there, that you're going to do some blood, you're going to do some EKG, or just go right there to the laboratory. They just go there by inertia. They sometimes not paying attention to anything. Oh, the doctor gave me this, and they don't even know what is that for. Well, you're going to read it, and you're going to see what it is, and you can explain it in your own terms. Because the patient didn't pay much attention to what the doctor says. The patient feels more comfortable asking you questions, you as a medical assistant, than responding anything to the doctor. See, the doctor have already asked them, do you have any questions? They don't have questions. But then when they approach you, then they have all these questions because they feel more comfortable with you. So you're only gonna respond things that you know, things that you don't know. You refer those questions back to the doctor. You have to do that. Don't allow your patient to leave the office if they have doubts about something. Because believe me, they're gonna go home and they're not gonna follow any instructions that you have given them. They're not gonna do it because they are not comfortable with any of these things that you told them because information was not given to them, so they don't feel like they need to, accomplish any of these directions or instructions. That happens all the time. So just make sure that, even though if you don't have to tell them anything, says, excuse me, Mr. Mrs. Smith, do you have any questions for me? Remember, you said for me is just to isolate the doctor in a way. But actually, if there is something that is not what you can do, then you're going to refer this to the doctor. Remember, that's how lawsuits happens. Because we don't clarify anything, patient needs clarification. Patient needs to understand everything that is going on to their level. That's that's the reason why we don't use medical terms. But you see, the doctor don't have much time to be explaining these over and over. So it says, I'll go to the front and they will instruct you some things because kind of you feel more comfortable and they not kind of, according to them, wasting too much time because they're going to see the next patient. And then you're going to spend some time trying to clarify whatever instructions have been given to them that they are not clear about it. Because we're doing this most of the time, so we learn it. That is okay. You're not going to give instructions or something that was not given by the doctor. And if you're not feeling comfortable, you're not going to do it anyways. You look for one of your colleagues that might be more experienced to do that job for you. And if there is no one else, hey, I'm going to redirect you to talk to the doctor. So any concerns about anything with the patients needs to be addressed right there, whether by you, whether by someone else that knows how to handle these situations. But you have to do it. Clinical, we continue preparing and administering medications as directed by a physician. So now you got to be very careful. Now, I know probably someone in there is saying, well, if we are not supposed to be administering medications, why art is written in this book? I don't get it. Well, I'm going to tell you why. It turns out that laws varies from state to state. So there are few states when you are allowed to do certain medications, or they were allowed to do. But in reality, that's not the case anymore. But these publishers, these editorials, whoever, make these books, they don't change certain information. So just because it's written in this slide does not imply that you have to do it. That was because back in the days, certain states allow the medical assistant. See, New York is very strict with a lot of things. And because you are educated here in New York, well, I'm going to tell you the things that you cannot do within this state. I don't know if you're going to move or not to another state. That will be your responsibility to find out. But while you're here in this class, in this state, I'm going to tell you things that you cannot do. Because if I leave it open, then guess what? You probably are going to be curious to do it. And I don't want to put you in that situation because that is a no for medical assistants here in New York. Remember, things are changing, things are evolving. Once again, the medication that you can do are these vaccinations. If your doctor authorizes you to do so, if they train you to do so. Anything else, you won't be able to do it. So if you're working with a pediatrician, they have a pediatrician nurse, so you don't have to do it. So that's basically what it is. Now, be careful with how you understand this slide. Explain preparing and administering medication. You do not prepare, you do not administer medications. No. Yes, it's a no. Now, the next one, authorizing prescription refills as directed. Pay attention for the last word because this is not something that you are going just to be doing, because then that's calling that practicing without license. You're not authorizing prescription refills. You know what is a refill, right? A refill is a medication that has already been prescribed by the doctor. But because the pharmacies are not going to give you these refills all together, let's say you have 3 refills, 5 refills. They give you 1, you have 4 left. So every month you have a refill, so you don't have to go to the doctor to ask for the medications again. That is the reason why some of the patients receive refills for certain medication. Not every single medication you have a refill. So in the prescription, it says refills, this many. Usually we don't go beyond 5 refills. Why? Because after that, we need to be evaluating you. We need to run a blood test to make sure that you are not having some toxicity levels due to so many medications. So when it's directed, it has to be directed by your medical doctor. So what it means is this, that the patient stops by your office, they need a prescription refill. So then it says, oh, I need a refill. So, okay. So you're going to go there because whatever refills they gave you first, over. Now you come. Remember, the doctor don't want you to give you refills because you got to do some tests, some blood tests, some other stuff, some questionings that the doctor is going to do. They're going to evaluate you. to make sure that everything is going well, and then whether you need or you don't need the medications, whether the medication is working or the medication is not working, whether you need to increase the dosage, decrease the dosage, you need to actually remove the medication. You don't want the medication, that is, discontinue the medication, start with something else, or you just don't need the medication. So for that reason, you can just, listen, I just need a refill. Sure, not a problem. Let me call the pharmacy. No, you cannot do that. Not if you have not been directed by the doctor. Now the doctor will do this because the patient calls in or the patient stops by and he says, I need a medication refill. So what is the next step? Patient has to talk to the doctor or you talk to the doctor. Dr. A, I have Mr. and Mrs. Smith, and this is you have to know who is the patient. You need to have name, you have to have last name because the doctor is gonna open the medical records. You don't go there to the doctor, I have a patient who needs to refill. What is the patient name? I don't know. That doesn't sound good, right? No, you have to have the patient's information. Can I have your insurance card, please? Do you have an ID, like, state ID or some driver license, something? So you go say, oh, it's patient this, because sometimes if you have electronic medical records, well, if it is paper, you have to look for you have to pull out the medical records and bring it to the doctor. Now you have to make sure that the doctor is available. Do not storming into the patient room, the doctor's office, if they are seeing someone else. You knock and you ask, or you phone them. Remember, this is a lot of stuff going on right here with the medical doctor. Remember, you're a new grad. You're probably gonna be doing things that, probably didn't cover. Try to cover as much as possible. Because in the real world, nothing is written right here. You don't see any of those things. But I tell you how the real world works. So you're gonna get the medical record number or the patient information said, I have Mr. or Mrs. Smith right here. She wants medication refilled. She wants this medication. The doctor is gonna go over inside the medical records, enter the patient initials, whatever they have to find the patient's information. Says, oh, yeah, please, can you call the pharmacy? Here's the information, call the pharmacy and, ask them for a refill. But the doctor has seen already the history of the patient, the condition of the patient, the medication that the patient is refilled. Most of the time, 99% of the time, the doctor says, register the patient, I'm gonna see the patient. I cannot give the medication, I need to see the patient. And that's exactly what you're gonna do. Now, be careful with this again, because this is a problem that happens. I've been through that with medical assistants, with nurses, that you authorize this medical assistant once for this particular patient. Now, the next patient comes in. Oh, if I go there, the medical doctor is going to say, yeah, call the pharmacy. Every patient is a different case presentation. For every single patient, we have to do the same procedure. Doctor needs to know what is the patient there for, whether the patient needs to be seen or else. So don't take this up on yourself, because that's how you get in trouble. Some doctors are very friendly with the medical assistants, with the nurses. That does not imply that you can do things that you are not supposed to do. Because when it comes to my license, I'm first. They're gonna throw anyone under you, under me, on the bus. So in a serious situation, there is no nice doctor, there is no nice nurse, there is no one there for you. So do the right thing. Think about you first. What is it that I'm supposed to do? These medications are very sensitive. That's the reason why we don't allow to give medications in the first place. What is it that we're going to authorize you to prescribe or to call the pharmacy? And this happens most of the time when you have friends or family members. You don't want them to go through this hassle of waiting or something like that. They think that you can do them a favor. Well, you're not doing a favor because you are crucifying yourself. I've seen so many things, guys, in my whole time of experience that if I start mentioning them, we're not going to finish. But believe me, following this clinical duties that you're supposed to follow, I'm just going to go over these things and explain you things that are not going to get you in trouble. Because they are here for a reason. So when it comes to medications, very sensitive. When it comes to diagnosis, very sensitive things. Everything is sensitive within your workplace. Yeah, sometimes we want to feel like, oh yeah, well, I can do that. Yes, you can do it. Now, are you authorized to do it? That's what you have to think about it. And what are the consequences if something goes wrong? Remember, this happens mostly for family members or people that you know. And when they get in trouble, they get you in trouble. They're not going to hold back. So be careful. Drawing blood, of course. Taking electrocardiograms, that's your job. That is something that you cannot refuse to do because, see, what is it that drawing blood? Well, nobody has died because I draw your blood. The only thing that I can do is I'm just going to leave you a bruise right there. Nobody's going to die. Nobody suits for a bruise because these are common situations that happens when you're drawing blood. Drawing blood can be simple, but sometimes it can be a little more complicated, particularly when you don't see the veins. You can see the veins, but if you have an elderly patient, these veins are kind of collapsed. You're going to try more than once and still. But they're not going to die from that. Nobody's going to die because I do an electrocardiogram because it was wrong, because the leads was, they were kind of misplaced. Nothing's going to happen. It's just that you didn't do a good job, but nothing is going to happen to the patient, except that, they have to stay there longer. It says right here, removing sutures and changing dressings. That was long ago. So first of all, in a doctor's office, doctors do not put stitches or sutures. They don't do it. So what is it that you're going to remove? Nothing. Changing dressing. If you have something, an injury, and they put dressings on you, you're not going to be changing because they usually go to the emergency or to the urgent care. So these are the things that you're definitely not going to be doing. So be careful. I will tell you when we get to this part of placing and removing stitches or sutures, probably you're going to have a question in your exam.